Stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, everybody. Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency servicing Palm Beach County, Broward, and Miami-Dade. Our number is 954-717-7027. And we are here today with Dr. Melyssa Hancock, and she is with Nose and Sinus Institute of Boca Raton. The phone number is 561-939-0900. And she is so delightful to speak with. She is actually a facial plastic and reconstructive surgeon, also served as a clinical instructor of plastic and reconstructive surgery. Thank you for coming to the show.
Sure.
We appreciate you taking time out of your schedule. We know how busy doctors are and offices.
All good. Excited to be here.
Yeah. So, Dr. Hancock, tell us a little bit about your background and where'd you go to school, what made you want to become a doctor and go down this path?
Sure. So, I'm actually originally from Connecticut.
Mm-hmm.
If you ask my parents why I became a doctor, I just said that just to get them off my back for a long time.
Okay.
I have no doctors in the family or anything, but
Okay.
I just was good at science and math, and I just kind of kept going in that direction.
Nice.
But I went to undergrad at James Madison University in Virginia.
Okay, nice.
And then I went right to medical school at the University of Maryland in Baltimore. And then I did my residency training in otolaryngology and head and neck surgery, which is ear, nose, and throat,
Okay.
at Georgetown in Washington, D.C.
Easier to say ear, nose, and
Yes,
throat than
yes.
otolaryngology.
Try to spell it, it is even harder.
Okay.
And then I did additional training, which is called a fellowship in facial plastic and reconstructive surgery. And I did that in Richmond, Virginia at VCU and at a private practice there. And then eventually it just kept coming south. And that's how I
nice.
ended up in Florida.
Well,
So
we're glad you're here.
yes, thank you.
So that is such a, it's an art, what you do. It really is. So for you to take on that endeavor, that's very, very brave of you to go down that path, because we do need great plastic surgeons who do reconstructive and who do these types of surgeries. And as a matter of fact, when you came into the studio, somebody happened to say, "I know you. You did my nose." And I looked at her.
Totally not staged either.
Not staged. And I said, "Wow, she has a beautiful nose."
Yeah.
So,
yep. I mean, that's where, really what we do in our office is we do both the ear, nose, and throat sort of general ENT stuff. So we see everything from ear infections and allergies to throat pain and difficulty swallowing. But we have a special focus in the nose and sinus problems. So we do both functional, and then my specialty is I also do the cosmetic stuff. So I fix the inside and I fix the outside of the nose.
well, that makes sense, because if I'm going to you and I know that I have an interior problem and I say, well, I'm at it, I would like to have a little something tweaked.
Yep.
So might as well do it all, one-stop shop, and
Yep.
just have it all done there.
Yep.
I mean, that makes perfect sense.
Yeah. Well, it's a niche really, because ENT trains specifically just on the face, and then the facial plastic surgery part is just more in depth and more training in specifically just the face. And that's what separates us from general plastics, for example, which does, breasts and body and butts and all that stuff. I'm just neck up, and that's it. So
that
you
makes
really
sense.
get, kind of the, we really hone in on the functional and the aesthetic stuff.
Yeah. So how old are some of the patients that are going to your practice? What's the age range?
It really depends. We see adults, so we consider, 16 until 116 or older. And it really just depends. Different demographics are seeing us for different things. So, for functional problems, allergies, sinus congestion, difficulty breathing through the nose, snoring, we see, that throughout any age.
That's a big one. Snoring.
Snoring, yep.
Yeah, that is a big one. I didn't realize until I woke myself up snoring.
Yep.
Like, I guess I do snore.
Yeah, yep.
So what is the main problem? Like, people are snoring. Is there blockage or what is that?
So sometimes it can just be because of pathology in the nose, right? You're not breathing through your nose, you're breathing through your mouth, and it's just, snoring is just air going through a narrow passageway and making a sound.
Okay.
Sometimes it's something more like obstructive sleep apnea, where you're actually obstructing your own airway, and that's what's causing you to snore or wake up in the middle of the night gasping for air. People who find themselves really tired during the day, having to take frequent naps, having to sleep in separate beds from spouses because their snoring is so bad, or the noises they make while they sleep are so bad.
Yeah.
Those, again, that is more likely obstructive sleep apnea, but there are tests to figure out if it's just snoring because of the nose or if it's something more like obstructive sleep apnea.
Yeah. And so if somebody goes to you and they have allergies, so tell us about the workup. How does that work? What would that look like?
Sure. So the first thing is making sure you have a complaint that we can actually treat, of course. So we would ask you all about your medical history, about your symptoms, any other surgeries that you've had. We do a physical exam, and oftentimes we'll do something called a nasal endoscopy, which is where we use a little camera to look inside your nose. It doesn't hurt. It's not scary.
Okay, I was going to ask you that.
Nope, it doesn't hurt. It's very easy.
Okay.
And then there's other workup that we may do, like a CT scan of your sinuses. We may do allergy testing, or like home sleep test or something like that, depending on what your complaint is.
Sure.
And that helps us really figure out how can we treat your problem. Is this something that we would use medication for, lifestyle changes, or is it something that surgery is required for?
I see. So what are some of the common allergies here in South Florida?
Dust and mold.
Dust, oh wow.
Yep.
So we get to
Yep.
really be on top of keeping
Yep.
that house clean
Yep.
and no mold and no
Yep.
dust.
Lots of pet allergies, and I have a lot of patients that come in and say, "Oh, but my pet is hypoallergenic. It's a doodle or whatever."
Oh,
And
yeah.
Hypo being the kind of operative word there. It means less allergenic, not completely.
That makes sense.
Not
Yeah.
allergenic.
So now what about like some people who complain, they think they have deviated septum, or what are other possibilities? We were talking to somebody before the show. So can you explain to us what
Sure.
are the different things that could be possible scenarios?
So again, that workup really helps us understand exactly what the problem is. Sometimes it's allergies, right? And there's no surgery to cure allergies. That's really a medical problem, and so that's something where we can actually treat your allergies. It's not just there's medications, but there's also allergy shots, and then we also have we have a special toothpaste that we can cure your allergies with. So literally you brush your teeth and you cure your allergies at the same time.
Is that a prescription toothpaste?
Yep.
Whereas everybody has a different
Yep, we use
compound?
Yep, exactly. It's personalized for every patient based on your allergy
love
testing
that.
results. So, yep.
Guys, if you're listening, if you have allergies, go
Yep.
get your compounded toothpaste.
Yep, it's pretty incredible.
That is incredible.
Yep.
I've never heard of that.
Yep. So a lot of people have said, "Oh, I tried allergy shots in the past and they didn't work," but sometimes it wasn't the right mix for you, or you didn't do it long enough, or it's just, there's something else out there that we can do for you. It can be sinus problems, okay? You can have something called chronic sinusitis.
What is that, chronic sinusitis? What does that look like?
It's something that we diagnose based on your history, and then also the results of your CT scan. So it means that there's inflammation in the sinuses.
Oh, I see.
And it can lead to facial pressure, pain, headaches, runny nose or postnasal drip,
I see.
sense of smell problems. But any kind of combination of those symptoms can be related to sinus problems, or again allergies or whatever. So that's why that workup is important. Other problems you can have, other than a deviated septum, you can have a nasal valve collapse. So, patients who see...
Are you born with this, or is this developed over time?
It's usually something that's developed over time, just kind of depends on how your facial structure develops over time. And then depending on what else is going on inside the nose determines if it's really symptomatic or not. You know, a lot of people have deviated septums, but they don't need surgery for it. They don't even know they have it.
Right.
Some people think they have a deviated septum because they
Right,
can't
right.
breathe, but it's really not a deviated septum, and it might be one of these other things. You know, I tell patients that if you want to know if you have nasal valve collapse, which is a different sort of pathology, you can try Breathe Right strips at home.
Okay.
And if those help you breathe, then there's a possibility that that's what you have.
Okay.
And again, there's different ways to treat that too.
Good to know. And what I love about your practice is that there's also other plastics, right? What other type of surgeries are they doing there?
Yep. So my specialty is rhinoplasty, so I do the cosmetic work on the outside of the nose, but we also have another doctor, Dr. Clint, who does all the aging face. So she's our facelift, neck lift, eyelid, brow lift, anything else related to cosmetics of the face, and so she's the expert in that.
I love that. So
Yep.
if I go get tested for allergies and then I decide, well, you know, maybe
Little
this,
nip tuck at the same
maybe
time.
a little something over here.
Yeah.
I mean, might as well if I'm
Yep.
there
Yep.
and I'm wanting to be able to, obviously.
We're really a one-stop shop for anything of the face. So,
I really do like that.
yep.
And do you, you must have people who go just because, don't give me the allergy test, I just want a rhinoplasty.
Yep. I see a lot of patients who don't have functional issues. They breathe just fine.
Right.
Their main concern is how their nose looks, and they want to fix that. And that's okay too. Those are, I mean,
Sure.
I always tell patients that the best reason to do something from a cosmetic standpoint is for yourself.
That's right.
You know,
That's right.
you know, something that you've been wanting to do, or something that, you know, we all have different things that we feel self-conscious about.
Sure.
You know, and I think, who are we to judge what you feel self-conscious about?
Right,
It's
of
just
course.
as long as it's realistic and it's something that, you know, you've wanted and you're doing it for the right reasons.
What's the recovery time on a rhinoplasty?
So about a week is your like real kind of downtime, if that. You know,
Okay.
I'll say most of my patients are actually pleasantly surprised with how good they feel. They feel congested. They have a cast and tape on the outside of their nose. But after a week, that cast and tape comes off. Any bruising that they may have is usually
Sure.
gone within a week or two. And I like to tell patients that you're restaurant ready at 2 weeks.
Okay.
So, you know, if you went out and anybody who didn't know you before wouldn't necessarily know that you've had anything done. But of course, it takes a lot longer than that for everything to really heal. It can really take up to a year for everything to heal.
Oh, interesting.
But that doesn't mean you're walking
Right.
around with like a big swollen nose
Sure.
for a year. But
Right,
yeah.
but the full healing, 100%,
Yep.
could take up to a year.
Yep.
Wow, that is
Yep.
interesting. So yeah, I think we're going to have a quick commercial break.
Okay.
And we'll be back. I think that's what we're doing.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks for tuning back in. We are having a great conversation with Dr. Melyssa Hancock. Her number is 561-939-0900. She is a facial, plastic, and reconstructive surgery specializing in rhinoplasty, right?
Yep.
And so what I like about what you offer where you're at is, you know, maybe I don't have necessarily a problem. I get checked and I'm like, well, you know, now that I'm here, I'm really not happy with whatever it is. And so you can take care of that.
Yep.
Yeah.
So, you know, there's, it's with all the social media that we have out there,
Yes.
you know, people are becoming more aware of what they look like and what features, certain features bother them or whatnot. We were talking about before the Zoom
Yeah.
effect after
Yeah.
COVID. Of where,
That's right.
You know, everybody was looking at themselves on a computer and seeing double chins and wrinkles that they didn't notice before, or tired looking eyes. And,
So true.
You know, people just became more aware of these things. And I think because of all the social media and the internet and just the ability to get all this information, it can be
a double-edged
Yeah.
sword, I
Yep.
think, right?
absolutely. You know, I mean, it's there's a lot of information, and some of it's good, some of it's not good. But you know, that's where people come in and they just at least want to get more information and know what they may be candidates for or what the options are. And not everything has to be surgery. There are, you know, minimally invasive options. But if somebody comes in and they don't like their nose, and, you know, that's where we have a conversation about what don't you like about it? You know, what is it that really bothers you? And, you know, when I see a patient, I like to really understand their motivation for surgery.
Okay.
You know, I like to hear
that.
that patients are doing it for them, you know, not for somebody else, not for,
Yes.
you know, some social media attention or something like that.
okay.
It's something
Yeah.
that they've always wanted, and they really just want to do this for themselves. And then we talk about, you know, what is possible and what's not possible as far as surgery. So we take formal photos. We have a nice photo room where we take pictures, and they look like mugshot photos, but that's
Okay.
what they're supposed to look
Yeah,
like.
yeah,
And I edit those photos, and the patients get to see what those simulated photos look like, to see what their nose would look like. And then we just kind of go back and forth, and if they like it or they don't like it, and we modify it so that we can get on the same page.
Yeah, because I feel like maybe some people might have an unexpected, you know, an unrealistic expectation. Like,
Yep.
it's got to be like this. And
Yep. Well, there's a lot of factors that go into that.
Right.
You know, I mean, your anatomy in and of itself can determine what's actually possible.
That's right.
You know, it may be that there's some celebrity whose nose you really like, but or somebody on, you know,
Yeah.
TikTok or Instagram or something, but that may not be possible on you, or it might not look good.
That's
you know,
right.
I mean, sometimes these certain noses just don't fit your face, and that's where I feel like it's, you know, my job to be honest with patients and
Absolutely.
let them know that, you know, that's just not going to look good, you know, or it's, you know, it's not going to serve you well your whole life, or worse, it's going to affect your breathing, right? I mean,
Right.
it's always a fine line between making sure that what we're doing is not going to compromise the function of your nose.
very important factors.
Yes, because that's actually the most common reason that patients seek revisions after rhinoplasty or nose jobs, is that they just can't breathe through their nose.
Oh, interesting. I
Yep.
didn't even think of that. Oh,
Yep.
wow.
So when you're taking stuff and moving stuff around in the
Right.
nose, you know, you don't want to compromise too much of the structure.
Makes sense.
Or it becomes a real problem. So at that point, the nose may look good, but if it doesn't work, you're not going to be happy.
Yes,
You're going to bring on a
that's
whole host
true.
of snoring and mouth breathing and all the other issues that come with that.
So I imagine you might have seen some patients who've had nose jobs in the past, and then you have to come in and do the revision.
Yeah.
Okay.
Yep.
Interesting.
And it's, you know, I feel like that's a whole sort of specialty in and of itself.
Sounds like it would be.
Yeah, you know, just being able to identify the problem and walk patients through it, because it's a more, you know, it can be a more difficult experience for patients who have already undergone a surgery and they didn't get the result they wanted, or, you know, didn't, or had a problem with breathing
Sure.
after it. And so that's sort of that's its whole sort of niche.
Yeah, it is.
But
It sounds like it is.
you know, I mean, whether it's a revision facelift or a revision rhinoplasty, you know, those are all different sort of scenarios where we have to make sure it's the right decision to make.
Absolutely.
You know, there's some patients where revision surgery is just really not the best option.
Okay. Yeah, and you're the professional to let them know that. So
Yep.
thankfully we have great doctors like
There's
you
some of us that
who
say no.
that you say
Yeah.
no and you
Yep.
say it's not going to work. So
Yep.
thankfully that's good to know.
Yeah.
Really good.
Yeah.
So Dr. Hancock, I know our audience, you know, they're listening, they may want to know do you accept insurance?
Yes.
Oh,
Yep.
okay, wonderful.
Yep. So we accept most insurances for anything functional related, of course.
Of course, yep.
And it really, but we accept a ton of insurances. I couldn't tell you.
That's okay.
thing
We'll
about
have
them.
them call. Let me
That's
give the
right.
number again. 561-939-0900. They can call, and anybody who answers the phone, I'm sure can
Yes.
go over that and give the
Absolutely.
information.
Yep.
Yeah, for sure.
Yep.
And I like that you sound like a very close-knit team,
Yep.
that you kind of
Yeah.
work well together, it
Yeah.
sounds like.
There's
which is-
actually about 20 something of us in the office.
Oh,
Yep.
nice.
So there's 3 doctors and 2 PAs that are in our
Okay,
office.
good.
And we've got our clinic area, we've got the allergy department, we have our CT scan. We actually also offer hearing tests, so hearing
Oh,
aids.
okay.
So we have that whole aspect of the office as well.
Interesting. I didn't even think of that. Right,
Yep.
hearing aids.
Ears, ear, nose, and throat. We do some ears too.
Yeah.
Yep.
So, you know, as we age, I imagine the hearing does get affected.
Yep.
I know that. I
Yep.
remember hearing my grandmother, you
Yep.
know, what? Can't
Yep.
hear you.
Can't hear. The TV's up really loud.
Right?
Yep.
Yeah, that makes sense. So these are things that we get to maintain a healthy, you know, testing, I imagine.
Yep.
And they'll be able to, because could it be just blockage in the ears?
Yeah, it could just be earwax.
There
Sometimes
you
it's
go.
just as simple as that, and that's a nice, very satisfying, easy fix. So
Wow.
be done right in the office.
Oh, that's good. So
Yep.
you do a lot of in-office things that people can go in and
Yep.
be done and be in and out.
Yep, absolutely.
Okay, good.
Yeah.
So, Dr. Hancock, any, you know, last minute like advice or any feel-good stories you want to share with us of any patients that maybe had some really great success?
I
Or
mean, of
whatever
course,
you'd
I
like.
could go on and on and on about that, right? No, I think, you know, like I said, my specialty is really the inside and the outside of the nose. And I think that, you know, one of the biggest complaints I hear is patients who have said, oh, I've suffered my whole life. I've never been able to breathe through my nose. And I say, well, you're here and that's great. You just got to get here and we just got to figure it out. So I encourage people, if you're having a problem, you don't have to suffer your whole life. You know, you can come in and get help, and what you do about it is ultimately up to you, but at least get some answers. And you know, we're a really good team, and we like to think we take really good care of patients, and we want to help you breathe better and hear better, whatever it is that it is.
Yeah, I think people do have that initial fear of, you know, what they don't know, you know, they're maybe afraid of what
Yeah.
it could be. So just taking the first step and finding out, you know, because there are natural options, right?
Yep.
There's also,
There's lots of options out there, and it's just a matter of figuring out which ones are applicable to you and realistically applicable to you, not Dr. Googling. You know, that's
a big problem,
Yeah.
Dr. Googling. You
Yep.
know, you know, with
another
the-
double-edged sword.
It
so.
is, because there's so much information, Dr. Hancock.
Yeah.
So we go there, we think we know all these answers, and
Yep.
you're probably like, no.
I mean, you know, sometimes they're right. Sometimes
Yeah.
Dr. Google's right. But, you know, again, I think people, the self-diagnosis or being afraid of what Dr. Google says, you know, it's not always a worst case scenario. But the first step is just really seeing somebody who specializes in that and finding out what the problem is.
Yeah, I agree. I know that so many of us think we know the answers if we go on Google, but I think what happens, I'll speak for myself, is I end up going down these rabbit holes.
Yep.
And it's like,
Oh, we all do, yeah.
right, why did I do that? Because
Yep.
now I'm worried about something I wasn't even concerned
I know, you
about.
find a whole new problem.
Find a whole
Yeah,
new problem.
Yep.
So I think the best bet is that they call,
Yep.
they go see, and you get I'm sure you have people coming from all over Palm
All
Beach
over.
County,
All
over, right?
All over Florida. I
Oh,
get people from
nice.
even out of state. So
Oh, that's exciting. All right,
so-
I'm gonna give your number again. So it's 561-939-0900, and the website is www.nsibr.com.
Yep.
Right, and that's the Nose and Sinus Institute. And yeah, so we are so grateful that you
Thank you for having
came
me.
today,
Thank you.
and we're excited to have you back one day and you
Wonderful.
give us some updates on everything that's going
Perfect.
on in your world.
Awesome.
All righty.
Well, thank you very
Thank you
much.
so much.
all right.
All right. Take care.